I want to start. I have a lot of information to go through. My co-host, I think he'll probably be on in a second. I think I'm sure. But so good to see everyone. Happy to be here today and so excited to talk about this topic. Now, I know most of you I see and recognize your names, and so it's great to see you. So, of course, you guys know me. I'm Dr. Rodney Harris. I'm an instructor here at the Chicago School of Professional Psychology, and excited to talk about, I am excited to talk about this topic, to spend some time with you on this evening. I have a lot to talk about, so you're going to see that I'm rushing because there's a lot of information that I want to present. So I'm going to go ahead and get started. Here we go. So this topic's don't push us because we're close to the edge. Unpacking suicide as a public health crisis. Couple things I want to talk about today is I want to analyze national and local suicide statistics from a micro and a macro level and review some of the latest trends in the research. I also want to discuss how culture and worldview of African American impacts suicide research and discuss some of the best practice models that are throughout the US. I also want to tell you that sometimes when you're digging in data as a researcher, sometimes research takes an unexpected twist and turn. So sometimes when you're analyzing data, research takes a twist. And sometimes when you're looking at multiple research through multiple lenses, you discover additional pieces of data. And you say, okay, let me look at it this way. Let me look at it through this lens, and let me look at it through this lens. And I want you to know, this is a piece of what happened to me when I was looking at the data this time. And so there's an interesting phenomenon that we're going to find as we get towards the end. And we're going to talk about that. So here we go on our journey. So the first piece of what I did is I started to look at the suicide research, and I was updating it. I looked at the data through age, and there were a couple of discoveries that I made. So I want to talk about that. So here are some of what I came on from the ages of 10 through 44. Some of the leading causes of death for 10 through 44. Unintentional injury, suicide, and this is in rank order: unintentional injury, suicide, homicides, neoplasms, congenital neoplasm, homicide, heart disease, liver disease, diabetes, flu. This is from the years of, you probably wonder, 2018. That's the last year that the research was released. This comes from the CDC. It's the last year that research was released. It's from the ages of 10 through 44. 10 through 44. Does anything resonate for anyone? Let me pause and ask you. Anything resonating for anyone as you look at these numbers? What's coming up for anybody? Anybody having any reaction or any thoughts? You can type it, text it, you can come off mute and say it out aloud. Anything resonating for anybody? Caitlin, what they're saying?
Someone said that suicide ranks so high.
Okay.
The unintentional injury is interesting too.
Okay. Let me pause a second. I see that my co-host is here. I want him to take a moment to introduce himself. So let me pause as we're in it for him to say hello. to us. Co-host, would you introduce yourself quickly while I'm continuing to go through the research?
Yes, sir. Hello, everyone. I am Knight-McWilliams. I am currently a candidate to get my MSW at North Carolina Central University, located in Durham University. I also serve as a graduate assistant at North Carolina Central University, serving as a graduate assistant for academic enrichment. And I appreciate the opportunity to be here. Thank you.
Okay, thank you. Thank you. So, also something else that's interesting. Look at that number, the range of number that is from 10 through 44. Find that interesting, from the ages of 10 through 44. So the next piece of data that I started looking at, pulled out suicide. Suicide is a leading cause of death. So I took that piece of research and so let me dig a little deeper with that data and segregate that data by gender. And now the CDC only segregates that data. They consider gender as male and female. So I looked at that and this is what they said. And I want to ask you, as you're looking at that, what were the highest rates for males? What are you noticing? What were the highest rates for males? That's right, 75. Females, look at the rates for females per 100,000. That 45 to 64 category. This is 2018.
Dr. Harris, were those numbers completed or attempted?
No, these were suicides that were completed from the CDC. But I'm gonna give you some data on that in just 1 second. And then Grace, I'm actually, let me finish. Let me get through some. You're gonna see some multiple lenses. You're gonna see me do something. Let me ask you this. So also what I did, and I made an assumption, I didn't even look and see. I thought that sounded like your voice, Grace. I can't see. So in 2018, I decided to segregate the data through race. Let me ask you something. What are some of your assumptions and predictions as I look at this data through race? What are you predicting and assuming as I look at this data through race as I get ready to turn this slide? And you guys can come off mute. What are your thoughts? 2018, what are your thoughts? What am I gonna discover? What are we gonna discover? What are we gonna uncover? I guess you might say that's why I'm here. But what else might you say?
Dr. Harris, someone said that AAs don't commit suicide. That there's higher rates in white men.
Let's see what we got over here. Let's look at this. Per 100,000. Let's just sit with this a second. Male and female, suicide rates by race. So what is this telling us? That what race is resonating with us? What rates are standing out? Boom. What do you say? American Indian. Okay. So what's the problem? According to CDC, leading cause of death reports, suicide, 10th leading cause of death overall, second leading cause of death among individuals 1034, fourth leading cause of death, 2 times many suicide in the U.S. that were homicides, okay? Okay, this right here, I want you to think about this. This is $25 gift card. Caitlin, you gotta be able to pay attention to the check. They can get a $25 Amazon gift card. Any guesses? Those that know me. Okay, who thinks most of the suicides occurred in rural, poor southern states where there were a lack of opportunities? But if you can give me, I might even take it down to 4. I might take it to 3, where the highest suicide rates were. If you can give me 3 states, I dissected the data down to 3 states where the highest suicide rates were. 3 states where the highest suicide rates were. Give you a minute. 3 states. Highest suicide rates were. What might that look like? 3 states. Caitlin, anybody trying to get that $25, or all of them, they might not care anything about it. They don't need it.
Someone said.
Oh, wait, somebody's trying to get it. I see something going on.
Somebody said Washington. Another person said California.
Okay. Okay.
New York, California, and Washington. Alaska.
Okay.
Texas. Wyoming, North Dakota, South Dakota, Alaska.
Oh, okay.
Montana.
You better not be Googling anything, whoever's doing that.
Arizona. Oregon. A lot of Californias and Washingtons.
Okay.
There's a Florida and an Illinois that just popped up.
Okay. Those, okay, whoever, okay, I'm going to show you. That Oregon, okay, wait, no, you know what? I mean, I think we got it.
New Jersey, New York, California, Wyoming.
Okay, wait, okay. Boom. Here we go. So Alaska, I think they'll put one on the Dakotas. I forget to put the Dakotas up there. Mary, I think you were the closest. So yeah, look at this concentration here. This has been consistent. 2015, when I first started to look at some of the research, it's just consistently been the West. Arizona, Hannah, yeah, Montana, yeah, Wyoming, yeah, it is. So, Grace, what I decided to do was to do this. Yeah, I'm gonna talk about it. I said, let me look at this data. New lens, same data. So I think this is where, so I started looking at it through, took the age down, 10 through 17. Look at this. Same data, new lens. This is from the National Vital Statistics. Remember, so this is new, same data, new lens, looking at the same data. This is lens 2. Gonna look at it again now. Look at for what, anything jump out for you, 2018, 10 through 17. Pause, anything jumping out for you? Anything resonating for anyone?
It's really interesting to see accidents so high. Like, what do they consider an accident? Like a car accident, an accidental shooting.
The shootings more than likely would go.
Under homicide.
Yeah. Now, they might further classify it down here, but stay up there on that leading cause and go back to the race, and particularly around number 1. I find that, look at American Indian, the number 1 cause of death. Asian or Pacific API, what's the leading cause of death? As a researcher, as someone that studies African American, particularly as someone that studies what, particularly for African American males, I know, I've known for years, but I found that interesting, that I've never known that for that age group, for that demographic. 15 through 24 was generally the numbers that because it used to be 15 through 24 were the numbers, that was what the data, that was the data set, 15 through 24. So within the last couple of years, they shifted the numbers lower, 10 through 17, because children, particular age, have started to commit suicide at a younger age, attempt and commit at a younger age. This is a national battle statistics system. So I asked, from the age of 10 to 7, which racial group had the highest percentage of increase in the suicide rate from 2009 to 2018? Anybody want to guess? Why aren't we talking about this, and why isn't this receiving more attention? Frida, why do you think it is? Come off mute, please.
I think that in America, there's an assumption that the only groups that commit suicide are white men, white women. What we're learning here is that the Asian and Pacific Islanders, which is not, it's just not, I don't think that many of us consider individuals committing suicide from areas where there are large concentrations of Asian Pacific Islanders, and even more so American Indians. Because we don't get much news on that group, so we're not assuming. That's just not a natural assumption to make.
Yeah, actually, Grace had asked me about that. So Grace, and I can give you access to this. This was produced in a congressional report. And so that's why it's really important as you're looking at data, and I got something else I'm gonna show you. When you're looking at data and you're uncovering data, that you look at multiple forms of data. So Grace, if I would have stopped at that one piece of data and looked objectively at that one piece of data, that first piece of data from the CDC, I would not have uncovered this. So as I looked at CDC, then I went NIH, then I went to this National Vital Statistics. I uncovered this congressional report, which was produced, which was actually looking at this as a public health crisis, and it was produced for Congress. And as I was looking through this data, that was how I came up with this. And so I will definitely give you guys access to that. And so if I would have stopped at that, I wouldn't have uncovered this data. And so, which is fascinating. And so years ago when I was studying it, it wasn't mentioned. And then I started thinking, why aren't we talking about this? You know, why isn't this public knowledge, you know? And so yeah, I'm gonna talk about another piece of advocacy around something else that was uncovered. Yeah, and maybe that's part of the motivation to, ignored, and it isn't talked about, isn't discussed. And then we're going to talk about actually, Andre's going to talk about another piece of advocacy, and we're going to discuss another piece in just one second, and dissecting the data. So, and looking at that, so Grace, then I went back to SAMHSA. This is about suicide attempts. So anybody tell me, why are suicide attempts? Grace said something about suicide attempts. Why are suicide attempts significant? Why we want to pay attention to these numbers, particularly as it relates to suicide attempts? And why are those important? Yes, yeah, you go, Britain. That's right. Those that are, that's right. There you go. That's it. Want to pay attention to the attempts. Yeah, that's a high predictor of, that's what the research tells us. Particularly these two or more, can be a significant predictor. Particularly two or more that if people often say, people talk about suicide. So these attempts, so we're going to pay attention to this. And so we're looking at these across race, and we're looking at past year prevalence of suicide attempts among US adults. And so we're paying attention to that. How they're doing it, how they're committing suicide 10 to 17. I found there have been some changes in this data from before. I found this interesting, and this is from a different data set than I studied before, and this was contained in this congressional report, a great deal of it. and they include suffocation. Hanging was included in that. And so sometimes, like when you read the fine print, and particularly Frida, and I've done and Frida also has, I know Frida, that in group homes, for a lot of kids, when I was doing some research in North Carolina and researching kids that had committed suicide, a number of those suicides were committed in group homes that were committed in jail. And so a lot of those that were there had committed suicide there. And that was what was attributed to. And so that suffocation, they were included into that number. And a lot of the parents were skeptical of those deaths. And so the difficulty in labeling those deaths as suicide and even questioning, did my kid actually commit suicide? And that was some of the stigma that was associated, with those suicides. That was some of what was coming on. But we look at this and we look at it, in some of the cases, 50% is, and particularly for Black youth, 51% of those youth suicides were from suffocation. And that's changed over the years. Before it was firearms. So we see some of the changes and some of the shifts and changes and trends that have over the years. And so I found that interesting. And then so you see this shift, particularly for me, as I study African American suicide in children, looking at age and sex. Circumstances, let's look at some of the circumstances of kids, what was going on with them before. I just kind of looked at some of the data, because I can't go through all of these. And this presentation, if you want it, just send me an email. I'll give you this. But that report, I'll make that report. I'll give you guys, tell you how to access that report. It's fascinating, the data that was in here. And that's where this, most of these charts, that's where these came from. Talked about substance abuse, a lot of recurrent treatment for mental illness. They left a suicide note, depressed mood, history of thoughts, if they were treated for mental health problem, crisis in a couple of weeks before, then this breaks it down, non-Hispanic children, talks a lot about that. Also circumstances beforehand. This breaks it down by females. This breaks it down by males. Okay, Andre's gonna talk to us a little bit now. He's gonna talk specifically about.
Thank you, Dr. Harris. I will be talking about the suicide facts, and figures of North Carolina. Suicide is the 11th leading cause of death in North Carolina. It is the second leading cause of ages from 10 to 34. It's the 4th leading cause of death for ages 35 through 54. And it's also the 8th leading cause of death from 55 to 64, and the 17th leading cause of death from ages 65 and older. The total number of deaths by suicides in North Carolina is 494 compared to the national statistics of 48,344. So as a North Carolina resident, this resonates with me. And so I want to ask you guys, what is the problem and what are some ways that we could prevent this problem? Feel free to type in the chat if you would like to. Seconds. Okay, so to dig a little deeper, let's look at the data. Recent study at the University of Michigan, Rutgers University, and Washington University. So let's look at it from a different lens.
Here we go.
So here are some of the leading causes of death for young Black men. The first is accidental death. The second is suicide. The third is other homicides. And the fourth is heart disease. The fifth is cancer. Can anyone tell me what's the sixth cause of death for young Black males? Sometimes research takes an unexpected twist or turn. So can anybody tell me the 6 leading causes of death for young Black men? And I would tell you now, you will be surprised.
This is our other $25 gift card. Caitlin, make sure you get the address for, I think, the other person, so we can make sure we send the Amazon gift card to her as the person.
Was that Mary, that one?
Yeah,
Okay.
Just her email, or we can send it to her.
Okay.
Anybody want to guess? Or anybody want that $25 Amazon gift card? I don't know.
Police killing. Grace, okay. Anyone else want to take a guess?
I would think homicide.
Homicide, okay. Suicide. These are some good answers.
Overdose.
Overdose. Okay, we could go to the next slide to reveal the answer.
Okay.
So the answer is the use of police force. So somebody did get it right. I believe it was Grace.
Yeah. Great. Grace got that one right there. Grace, yeah.
So this includes the asphyxiation, beating, chemical agent, a medical emergency, a taser, or a gunshot. So the data speaks. 39 and 100,000 white men and boys were killed by police during their lives. Again, the data speaks. 100 and 100,000 Black men and boys were killed by police during their lives. Is this a problem? As an African-American male, I see it as a problem. Black men are about 2.5 times more likely to be killed by the police by white men. So do anyone else see it as a problem?
It's really a very big problem, because we talk about this in relationship to the instance of it occurring for Black men, like we're talking right now about, the murder that was in Minnesota. But this is a problem all across the board. So in terms of police reform, that should be a top discussion among everybody. I've just not heard a lot about Caucasians murdering other Caucasians as police officers. This is just a huge problem.
Yes, ma'am. Someone, Brenda says a big problem, and it has been for decades. Just to reiterate that this problem has been existing for decades, and we're continuously seeing it today. So yes, thank you for the answers. It is a problem.
What concerns me, though, is that the entire problem isn't discussed.
I want to make a point here that it was not my intent as I was looking at the research. I couldn't control the way the research turned. That as I was looking at suicide and looking at it through multiple lenses, that this is the way the research turned. So that this is where we are. So I didn't know this is where it would lead. So I just want to say, I actually did not know that this was the 6th leading cause of death. And ironically, Grace, how did you, I actually really had no idea. What gave you some clues that this might be the 6th leading cause of death? Why would you suspect that? To put you on the spot. Now, I know you don't even like talking in public, but we're getting you better at that, right, Grace?
Oh God. I guess just the climate the last year. I mean, we've been talking about police brutality a lot over the last year, and I didn't see that specifically on the list. And as soon as I said it, I was like, well, that could be considered homicide, so maybe I'm wrong. But just the climate.
Observation.
Yeah. And you know, I found it interesting, and I thought, am I going to put this in? Because I was like, this presentation is about suicide. And so when it came across that data, I thought, okay, am I going to go down that road? And I was like, okay, I'm going to put it in, and you're going to see what we end up, probably where we end. And so we'll continue to go down this road. And actually, that this research was completed in 2018, so 2019. And so it was before a lot of this had even transpired. And so I'm wondering if it, you know, when they would release the new research, would it even be higher? You know. Let's keep talking, Andre.
Yes, sir. So who is at risk? Who's at risk of being killed by the police peaks between the ages of 20 and 35 years of men and women of all racial and ethnic groups. Black women and men and American Indians and Alaska Native women and men are significantly more likely than white men and men to be killed by the police. Latino men are also more likely to be killed by the police than white men. So let's go into the fatal encounters. Data gathered from fatal encounters, a journalist led efforts to document police encounters from the police. Finding from the study. Study indicates the risk of being killed by the police is jointly patterned by one's race, gender, age. Police violence is the leading cause of death for young men and young men of color face a exceptionally high risk of being killed by the police. Inequalities and a risk are pronounced throughout the life, of course. This study reinforced calls to treat the police violence as a public health issue. Is this a problem? Who decides? How do they decide?
Mm-hmm. Mm-hmm. Yeah. So that's about where we are. Let me see how many more I got. Yeah. Okay. Is this a problem? Who decides? How they decide? And then I asked some questions about how do they decide around grants, funding, programs, research, and advocacy. So I want to ask you, we're going to spend the rest of our time talking, a little interacting. I might go back up. I feel like I rushed through some of them, dissecting some of the data. I have some programs at the end I'm going to talk about, specifically that are related to suicide, some of the best practices in suicide programs. But I want to talk about who decides if a problem is a problem, and what are some ways, particularly from an advocacy perspective, that you are able to decide if a problem is a problem, and what are your thoughts around that, and then what do you do? So you hear this information, talking about a couple of things, and then what did you guys think about the different sources of data, and how the different sources of data gave you these different lenses? And so that the data said this, the data gave you this perspective, that data gave you that perspective. Then as I talked about data from gender, I talked about it from race, and then I talked about the data through all these different lenses. And then I talk about from demographics And then as I continue to break down the data, and then how the one piece of data, how it took this turn and it led me here, and then how as I, my particular research focus particularly has been around African-American men, and my particular research focus has been there, particularly because of our personal interest in, because I had a cousin that committed suicide. And that is why I have, watching my aunt deal with her grief around my cousin committing suicide and making sense of that and studying suicide, grief, and women, and watching my aunt kind of deal with the stigma that's associated with that, and then watching patterns and trends in community, and now in BIPOC communities, like tracing patterns and trends throughout the years. And so my interest overall has been how to trace that and following that data and research. So I wanted to give us a moment or some opportunities to kind of chat, see what you guys say about that, talk about advocacy, even this as a social justice issue, and hear what resonates, what's coming up for you guys. Heard Andre talk about what was coming up for him as we went down this path. And so that we could have this bit of a discussion, this bit of a dialogue. And then for those of you that, as you see, I do have some programs, and I have some programs and talk a little bit about some of the mental health first aid and some of the other programs that I talk about, some of the other overall best practices that are throughout the nation, what they implement in communities, and some of the best practice, proactive, preventive programs that they're presenting in schools and in communities. Wonderful work that's going on in Tennessee that I've been studying for years, that at one time had some of the highest rates in the nation. Questions, talk, and come off mute, talk to me. You guys know, we can talk. Let's have a discussion, dialogue.
I think one of the reasons that we may have seen different statistics at different times is political, and who is in office, who can control the politics. I think we found out a lot of things have come from the CDC in the last 4 years. And possibly even NIH, that the last party in office probably had an effect on that. We've seen CDC information not being really without integrity. So when we ask the question, why was some of the data different? That could be the cause of some of it being different.
I know from a research perspective, if we don't write about it, if we don't research about it, if we don't present about it, it won't get out there. And so that's why it's really important that we are out here talking, researching, advocating. That's why it's important. When we come here, we hear data. That congressional report, Grace, that you hear me referencing, that was something that was the Congressional Black Caucus had commissioned for that report to be completed. And so it was a study that was looking at the alarming some trends in BIPOC communities. And so they asked for this to be produced, and it took a number of years. And so that was where that data was contained. And so that report took a number of years, and it's recently, I actually didn't know that it was produced. And so, but if it doesn't get out and people don't reference it, people don't have access to it and put it in the communities and you don't tell people about it, then you won't know. So.
I have a question. Has there been any research into increased suicides with Black men due to the police violence?
No, I have not, I have not, I'm not going to say I have not stumbled across it. There's someone, his name is Dr. Sean Joe, who's one of the leading researchers in that. I am going, I'm waiting. I have not seen it yet. I'm not going to say it's not out there. I am, I would be interested in the next couple of years. I'm certain something is going to come out. I'm certain someone is studying it, but I've not seen it yet.
Because I would imagine that as much police brutality as there is and violence, that would create such anxiety among young men, or of any of the men of any age, but especially young people growing up. Or maybe I'm wrong, I don't know.
No, I think between that and the pandemic, I'm interested to see what research is going to come out. I am very interested to see what research is coming. Since we're talking about this, I am interested to see, since we're talking about it, I know, and Andre, are you getting ready to speak? I definitely want you to go ahead and speak. I know I'm just even thinking about emotionally how I've been impacted by this week and the last 2 weeks, and watching the trial and processing the trial. And, it has been, way more than I think, reliving the last, reliving everything that has transpired, and not even being able to put words into it. It is more than I think anyone should have to bear.
But I think still, even though, and I agree totally with what you're saying, there seemed to have been an awakening this past summer. But to hear these experts support what the prosecution said happened is going to be a new awakening. It's a new phenomenon, even hearing these people speak on behalf of our men, even though the videotape showed it.
Okay. So, do you see some of the questions, the engagement questions? Make sure you kind of look at those. And we talked about most of them. I think I kind of went through some of those engagement questions. The high suicide rates were in poor southern states. Was that a true or false question? You guys remember? The high suicide rates, were they in poor southern states? Was that a true or false?
False.
Okay. So, and so was suicide the 10th leading cause of death for ages 10 to 14? Or is it the 10th leading cause of death? True or false? Put it in chat. All right. And amongst males, which group had the highest, amongst males, which group had the highest suicide rates? I think that was a question I had one up. Wait, did I go up now? Oh, amongst males, high suicide rates. Wait, amongst males, high suicide rates, which were among which high, well, I'm sorry, wait guys, I got it. Among which age group? I'll tell you that one. I'm sorry, I'll tell you what it is.
I think it was the group age 74 up to age 74.
Yeah, it's like that. So you guys said that. Okay, the most common method for suicide in 2018 among males and females was poisoning. Right. So guys, for the presentation, you guys are hearing me talk about some programs. These are some national best practice models for suicide prevention, community school interventions, mental health first aid, community school interventions, a lot of community. If you put your email, I will make sure that you get these interventions, but I want to pause and I want to ask you, I want to hear some feedback around these multiple lenses. And I want to tell you that as I started to look at the first set of data, what made me look at the NIH, and as I was looking at CDC, and as I looked at the third set of data, what made me question it was when I looked at it 10 years ago, looking at some what I felt like may have been some inconsistent, and it was that they were looking at it through a different lens. And then as I was looking at it through race, class, gender, and through some of those different lenses, I said, well, let me see what different sets of, through different lenses, what it might say. And so that's what made me look at through all these different lenses. And then I was like, well, let me ignore this and let me stick here. And I was like, okay, this is an interesting way that it turned. And so as I was working with Andre on it, we were talking and I was like, well, if this is the way the data's taking us, let's just go and see what happens. And so we ended up there. That's just the way the data, that's just the way the data turns. Sometimes that's the way it turns in research. And so with research, and actually that's the way it turned in my dissertation. The data was telling me giving me a lot of information that I didn't want. But that's not, that I didn't particularly like, but the data is the data. And that's the way sometimes it turns. And so that's why I said, the data speaks. And that's the way you go. So that's, it's a powerful lesson. And actually, him as a graduate student, it was a lesson that I wanted him to see, a lesson I wanted him to learn. So it was as a mentor, as a teacher, was something I needed for him to see and observe. So I want to ask you, as you're preparing to leave, preparing to go, thank you for your time. I thank you for your attention. But is there anyone that wants to say anything, observation? You guys know